Bill, you launched CEPI because you believe the world is unprepared for the next pandemic. What is CEPI?
CEPI is a coalition for epidemic preparedness, and the idea is to take a new way of building vaccines that could let us develop in less than a year a novel vaccine. They're called DNA-RNA vaccines, and so we'll fund a few projects to build specific vaccines, but not only will we get that, we'll prove out that these platforms can work, we'll understand the regulatory issues, and it gives us a chance of being able to respond in time when the next epidemic hits.
What are the new tools that we have at our fingertips to stop the next pandemic?
Well, right now, we're in the same situation we were in before, where it takes years to build a new vaccine. But the scientific idea of these new platforms could radically change that, so that a lot of the steps are sitting there ready. The factory piece, understanding the regulatory piece, and you just have to plug in some information, do some quick safety profiles, and then you can get into manufacturing quite rapidly.
And if we speed up this process, how many people are we actually saving?
Well, we don't always know the risk of an epidemic, and some epidemics, like a flu epidemic, could be absolutely gigantic. So it's hard to put a number to it, but we went back and looked, for example, at Ebola and said that if we'd had a vaccine within 30 weeks, it would have helped quite a bit. If we'd had it within 6 weeks, it would have been dramatically different.
How do epidemics impact our society financially, socially?
Well, the impact of a huge epidemic, like a flu epidemic, would be phenomenal because all the supply chains would break down. There'd be a lot of panic. Many of our systems would be overloaded. And so, we all hope that doesn't come along. But being ready for epidemics of different sizes, there's a lot more we should do, and CEPI is a step in that direction.
And you've said that we're in an amazing moment in science right now. What's next?
Well, we need vaccines for a lot of things, not just epidemics. We need a HIV vaccine, a tuberculosis vaccine, a malaria vaccine. All of those things are in the works, and over the next decade, I think most of those we'll get solutions for.
And we've come a long way from the work that you and Melinda have done over the years on malaria.
Yes, so all these infectious diseases, deaths have come down, new tools are coming out, and governments have been very generous at supporting this work in partnership with us and others. So it's really an incredibly good news story that health is getting better all over the world.